Parenthood begins with preparation. You rely on screenings and tests to tell you the whole story. But when genetic markers or critical signs are missed, you aren't just denied answers. You are denied the right to make an informed choice about your family's future. One client came to her doctors specifically concerned about a family history of a genetic disorder. She was offered an amniocentesis, but warned the risk of miscarriage was very high, so she declined. That advice was wrong. The risk was less than 0.5%. She was also not offered a simple blood test that could have identified her as a carrier long before amniocentesis was considered. She was given incorrect information and denied an informed choice. We are now fighting to secure the specialized, lifelong resources her child will need. In another case, the clues were right there on the screen: an abnormal fetal heart. But the sonographer missed the warning signs, and the silence was mistaken for safety. When the baby was born, the reality set in: a rare chromosome disorder requiring lifelong surgeries and 24-hour care. Suddenly, the family was facing a complex medical future with no preparation, no funding, and nowhere to turn. That is when we stepped in. We are now fighting to secure the funding that guarantees her future is safe. A mother's instincts were met with dismissal. She was told her baby was simply small, even though the scans painted a much more complex picture. Vital red flags were ignored, and the referral she needed to a specialist center was never written. The result was a shock at birth, a severe genetic condition requiring 24-hour, high-complexity care. We are now holding that clinician accountable, ensuring the family has the financial armor to face the future. Finally, we handled a complex case of amniotic band syndrome, where routine scans failed to spot the danger. The child was born with significant limb differences, injuries that should have been detected and prevented. The case was complex, and we were asked to help because of our extensive experience with cases like this. That experience enabled us to secure interim payments for vital equipment and therapies while future needs were assessed. We took the case to the High Court so expert judges could fully understand the evidence of the child's needs. The defendants admitted fault and agreed to pay appropriate compensation, securing the child's future. These stories prove that accurate advice and timely diagnosis aren't just medical standards. They are your fundamental rights. We bridge the gap between complex medicine and the law, ensuring families are supported and that every child receives the lifelong care they deserve.